Hello guys, welcome back to ASAN Network. I am your Dr.Salauddin, MBBS MS Orthopaedics, and I am about to complete my senior residency. So, welcome back to our fracture classification series. And today the smallest bone and the largest sesamoid bone that we are going to discuss is the patella fracture classification. Okay. So, where is the patella situated? The patella is situated at the lower end of the femur, just anterior to the distal femur in a triangular fashion. Okay, before entering into the classification in depth, we'll look a little bit about the anatomical aspects. Okay, so how does the patella move? See, it integrates with the anterior and the intercondylar notch of the femur. So here it integrates with the distal femur anterior aspect, and there are two facets in the patella. One, the medial facet which articulates with the medial condyle, and the lateral facet. Okay. Now coming to the anatomical aspects, there are four muscles attached to the patella on the top and one ligament attached to the lower end. Okay, what are the four muscles? That is the quadriceps femoris. Okay, so in the quadriceps femoris there are four muscles. Quadri means four. The four muscles, the first one is rectus femoris. Rectus femoris. Then all three are the vastus muscles. Vastus. In this vastus, one is medialis, one is intermedius, one is the lateralis. Okay. So this is the rectus femoris muscle, this is the vastus lateralis, this is the vastus medialis, and this is the vastus lateralis. The largest muscle in the quadriceps is the vastus lateralis, and the smallest bulk is with the medialis. Medialis has the smallest bulk. Behind the rectus femoris there is the intermedius muscle. And what these all four combine and form the quadriceps tendon. Quadriceps tendon, and it is attached to the upper pole of the patella. Okay, to the upper pole of the patella, the quadriceps tendon is attached. Coming to the lower end, it continues as the patellar ligament. The patellar ligament, it's attached at the tibial tuberosity. At the lower end, it is attached to the tibial tuberosity. Now, as you have already seen the mechanism of action. No, so when the patella is pulled by the quadriceps muscle, okay, the pull-off direction is towards the lateral side. As you have already mentioned, the maximum bulk of the muscle is at the vastus lateralis, so the strongest pull is towards the lateral side. Okay, but the resistance is offered by the patellar ligament. Okay, so in the mechanism of trauma, there are two types of mechanisms for the patella to get fractured. One is the direct hit and the indirect trauma. Indirect trauma. Because of the indirect trauma is because of the pull of the quadriceps muscle. Okay, the quadriceps muscle strongly if it pulls and the patellar ligament is restraining, then the patella will get fractured in a transverse fashion. Okay, this is indirect trauma because of the pull of the quadriceps. Direct trauma is when something hits the patella directly, the patella may fracture in different patterns that we will see according to the classification. Mostly when the patella is hit directly, the patella is most likely to get comminuted fracture. Okay, this is the mechanism of injury for the patella. As I have told you, because of the pull, the transverse fracture is most common. This is the transverse fracture, and in AP view you can see here is the lower pole and here is the upper pole. Okay, there is the displaced transverse fracture. In lateral view you can see the displaced transverse fracture. Okay, one more thing I need you to remember in this patella fracture is that the patella fracture, when you leave it, it is not going to unite. Even if it is a transverse fracture, this is not going to unite. Tell me the reason. Because of the strong pull of the quadriceps, the upper pole is always going to get displaced. The upper pole will get displaced. So there is always a distracting force acting on the patella fracture, patella transverse fracture. Okay. So coming to the fracture classification, the most important one is the morphological classification. And the most common type, as I have already told you, it is the transverse fracture. Transverse fracture is the most common type. Then the comminuted fracture when direct hit occurs. Then the vertical fracture. Then osteochondral fracture. And then is the marginal fracture. There are totally 5 types. TC, worm. Okay, transverse, comminuted, vertical, osteochondral and marginal fractures. TC, VOM. Okay, so transverse fracture, it's a horizontal fracture line, usually at the middle third of the patella. The mechanism is sudden quadriceps contraction. The injury is indirect type. It will disrupt the extensor mechanism. What is this extensor mechanism? So look at this video. The extensor mechanism is so this is when the quadriceps muscle along with the patella, along with the patellar ligament, this whole will work as in a single unison. Okay, the quadriceps muscle and the tendon, the patella and the patellar ligament, this all will work in a single unison fashion. Okay, this whole muscle, bone and the ligament, muscle, tendon, bone and the ligament are combined called as the extensor mechanism. Along with that, there are few things. First is the quadriceps muscle, then the quadriceps tendon, then patella, then the patellar ligament. Along with this, there is something called as extensor retinaculum. It is in the knee capsule and it attaches to the patella in the medial and the lateral aspects. Okay, it's again continuation with the extensor retinaculum. It attaches to the patella medially and laterally, and its continuation with the below patellar ligament and above with the quadriceps tendon. This whole is called as extensor mechanism. Okay, why it's called extensor mechanism? Because of the knee is extending with the help of this mechanism. Okay, so the extensor mechanism gets disrupted in the transverse patella fractures. When the comminuted patella fracture, there are multiple fragments and it is a direct trauma. It may be a dashboard injury or a fall on the ground, and there is a severe articular damage to the patellar fracture. Then the vertical fracture, when the patella is, if you think this is the patella, this is the vertical fracture. Okay, this is the lateral fragment, this is the medial fragment. So medial lateral fragment is getting separated through the vertical line is a vertical fracture, and this is also because of the direct trauma. Here the important thing you have to remember is the extensor mechanism is intact in vertical fracture. Okay, the knee will be able to extend even if the patella is getting fractured because it's a vertical fracture. Then osteochondral fracture is, the word itself says it has osteo and chondral. Osteo means bone and the chondral means cartilaginous part. So what is the bone? The subchondral bone and the cartilage bone. Near the articular area, the cartilage and the subchondral bone is getting fractured as a fragment. This is mainly because of the patellar dislocation. In the patellar dislocation, there is osteochondral fractures, and this is usually seen in young patients. Marginal fractures are small fragments from the patellar edges. This is when the patella will be usually stable. This is the whole patella. Small fragments medial aspect, or small fragment inferiorly, or small fragment laterally, or a small fragment upper pole. These are marginal fractures. Okay. So you can see in the image, this is an undisplaced transverse fracture. This is a displaced transverse fracture. This is a lower pole or upper pole is here, the upper pole fracture, if it is there, it's upper pole or lower pole fracture. Then it's a comminuted undisplaced fracture, comminuted displaced fracture, and a vertical fracture, and here is the osteochondral fracture. This is the articulating part. Here will be the articulating area. Along with the articular area, the subchondral bone and the cartilage. The subchondral bone and the cartilage getting fractured is osteochondral fracture. Okay. These are the X-ray images where you can see for transverse fracture, this is the upper pole and this is the lower pole. It's not visible clearly in the AP. In lateral view, usually we can define the transverse fractures. And comminuted fracture, it's usually missed in the X-ray. You have to, if the comminuted fracture is undisplaced, it may be missed in the X-ray, so we get an MRI or a CT scan. In MRI, it's definitely shows the fracture lines. This is the MRI of the comminuted undisplaced fracture. This is the vertical fracture X-ray. Here you can see this is the vertical fracture. Okay, and this is the vertical fracture in the, what is this view called as? This view is the skyline view. For patella, there are different views. This is the skyline view where it shows the intercondylar notch and the patellar medial and lateral facets in a, usually it shows the patellofemoral joint. Patellofemoral joint. The skyline view. How it is taken is, the patient flexes his knee. Okay, or if the patient lets the knee hanging at the table. Okay, this is the table. Here will be the film. There will be the X-ray film, and here will be the X-ray box, and he will be shooting in this direction. Okay, this is the direction, and here will be the X-ray like this. This is skyline view. Okay, this to show the patellofemoral joint. And this is the osteochondral fracture along with cartilage and the subchondral bone in the, this is the MRI. Okay. So based on the displacement, you can divide it as undisplaced or displaced fracture. When you say it's displaced is, undisplaced is when less than 2 to 3 mm. The displacement is less than 2 to 3 mm, then it is undisplaced, and the extensor mechanism should be intact. Then you can plan conservative, but usually undisplaced fractures also need treatment. Okay, displaced fracture when the displacement is more than 2 to 3 mm and there is an articular step of more than 2 mm. What is this articular step? If you can see in the skyline view, this is the normal. Here will be the, this is the articular area. Okay. So if the patella is getting fractured, for suppose let's say here, and is displaced like this, okay. So what is this more than 2 mm is, in the articular surface like this area, the gap here, this gap should be less than 2 mm. Okay, If it is more than 2 mm, that is articular stepping more than 2 mm, you have to definitely do a surgical fixation, and it's also a displaced fracture. Okay. So based on the extensor mechanism, as I have told you, what is the extensor mechanism? For knowing whether the extensor mechanism intact, you have to ask the patient to do a straight leg raise possible. If the straight leg raising test means, you have to ask the patient to extend his knee and lift the leg in a straight leg position. Okay. If it is able to extend the knee and raise the leg in a straight leg position, then the straight leg test is possible. Then the extensor mechanism intact, then you can plan for a conservative management. If it is disrupted, then you have to always do a surgical fixation. This is based on the extensor mechanism. Okay. Coming to AO classification. So the AO classification system is alphanumerical classification, and the number for the patella is 3, 4. 3, 4 is the number for patella. So 3, 4 is the number for patella, the AO classification system. 3, as you can see, any articular area in the AO. In my previous videos also, if you had seen, AO, the articular area is always divided into extra-articular fracture, partial articular fracture, and a complete articular fracture. Any articular area, these 3 will be compulsorily present. So patella is also a articulating bone. So again, patella will be divided into A, B, C, that is extra, partial and complete articular fractures. So we will see in detail what is A, B, C divided into. Okay. So 34 is a patella bone. A is extra articular fracture, and in A1 is an avulsion fracture. Okay, an extra articular avulsion fracture is A1. So what type of avulsions? Again, there are qualifiers in A1, that is A, B, C and D. A is proximal pole. Proximal pole is towards the quadriceps tendon. The proximal pole. B is the distal pole towards the patellar ligament. So if the distal pole is getting B, this is A, this is B. So lateral side is C, medial side is D. Okay. So A, B, C and D. This is the qualifiers for avulsion fractures, that is 3, 4, A1. Okay. So extra articular, partial articular and complete articular, A, B and C, as you have seen. A1 we have seen. Now 3, 4, B. So 3, 4, B is partial articular. So in partial articular, there may be a sagittal fracture. 3B is a sagittal fracture. Now 3B1 is an lateral fracture. Sagittal lateral fracture, 3B1. B1 is a lateral for B1. So in B1 also, B1.1 is a simple fracture, B1.2 is a fragmentary fracture. So simple lateral fracture is a B1.1, fragmentary is B1.2. Okay. So next is B2. B2 is medial. B1 was lateral, B2 is medial. In B2 also same. B2.1 is simple medial, B2.2 is multi-fragmentary medial partial articular fracture. So C is a complete articular fracture. So complete articular fracture in frontal or coronal plane. Both the frontal and coronal plane fractures are there. So C1 is a simple fracture. Simple C1 fracture. So C1.1 is a middle third fracture. Complete articular fracture. Till the articular area it is fractured, and this is the articular surface. Till the articular area it is fractured. So middle is 1.1 C. Proximal third is 1.2. Distal third is C1.3. Simple, middle, proximal and distal. Okay. Then C2 is a complete articular fracture with a wedge fragment. C2 is with a wedge. This is the wedge. Complete articular with a wedge is C2. C3 is multifragmentary. So comminuted articular fracture. Comminuted articular fracture is C3. Okay. This is the AO classification simplified for patella. So what are the important exam points that you must remember is the most common patella fracture is the transverse fracture. This is common, and the most common mechanism is an indirect injury due to quadriceps muscle pull, that is sudden contraction of quadriceps muscle. Okay. The most common mechanism for comminuted fracture is a direct hit or a direct trauma. The main clinical test for intact extensor mechanism. If you have to know the extensor mechanism is intact, then you have to do a straight leg raising test. Then the gold standard treatment for patella fracture is tension band wiring, TBW. Okay, tension band wiring. What is the principle of tension band wiring? The principle for tension band wiring is convert the distractive forces into compressive forces. I will explain it in a simple manner. So, this is the patella, this is the distal femur. Okay, this is the distal femur. In the patella, so what is the distracting force? Proximally, the quadriceps muscle is pulling, distally the patellar ligament is attached, so the distracting force is quadriceps muscle. Now I need to convert this into a compressive force. So how do I do this is, I divide the patella articular surface and the non-articular surface as area of compression or distraction. So this is the distracting surface, both particular surface. When it is distracting, if it is the transverse patella fracture, the first distraction occurs at the non-articulating area. Okay, so this acts as a compressing area and this acts as a distracting area. Okay, I will draw separately and I will show like this. Okay, the patella will be distracted like this. So the articular area will be acting as a compressing area, the non-articular area will be acting as a distracting area. So what we need to do is, we put a K-wire or CC screws near the articular area and we tie both the surfaces anteriorly in the figure of 8 fashion using SS wires. Okay, this is tension band wiring. Now what will happen is, when the quadriceps muscle, each time the quadriceps muscle tries to contract, okay, because of this intact surgical procedure by K-wires and the SS wires anteriorly, the pulling forces will pull the distal fragment towards the quadriceps muscle. This will cause compression at both ends. If the fracture is here, it will cause compression at the both ends, hence converting the distracting forces into compressive forces. Okay, this is the mechanism of tension band wiring. The mnemonic for the classification for patella fracture is TCOM, transverse, comminuted, vertical and osteochondral and marginal fractures. Okay, so if you want to understand more about the distal femur fracture classifications, hit my playlist button and you can subscribe my channel for more classification videos. And the most important one in the today's lecture is the update regarding my clinical regional mapping. This is a clinical regional mapping. I want to give a small detail about this upcoming series. This series contains mapping of each region. For example, at a shoulder. Okay, so if a patient is having a shoulder pain, then I am going to look through the anatomy of the shoulder and I am going to map each structure with the diagnosis and what probable diagnosis would the patient will be having. So my clinical regional mapping videos will be coming up next. Okay, subscribe for more interesting content. Thank you.